Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Elyssa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you.
Welcome, everyone, to the Tongue Tie Experts podcast. As you know, I alternate between talking about professional issues and talking to the real experts on tongue tie. And those real experts are the parents who have been through it. So today I'm thrilled to have Elyssa DeAlmeida, who is a mom of a 6-month-old daughter, and she's had quite a journey with Ophelia. And I want to talk about that today, just to give everyone an idea of different versions of this adventure of tongue tie, right? So welcome, Elyssa. Thank you.
Thanks so much for having me here, Elyssa.
So I saw your story. For those who don't know, for those listeners who don't know, we have a Facebook group called Breastfeeding Tongue-Tied Babies. And it's an amazing group because parents help each other there. And parents post their successes, their struggles, and there are pros that weigh in on it. But when Elyssa posted her story, immediately I said, we have to talk about this on the podcast. So do you remember what you posted? Do you want to tell us what you posted? Let's start with that.
Sure. And I have it up too, just in case I forget a detail. But yeah, so I had my daughter back in November and I knew I wanted to breastfeed. I wanted to exclusively breastfeed her. And so I had taken the class and done all the steps beforehand. And as soon as I had her in the hospital, I was having issues with the latch right away. I reached out to the hospital lactation consultant there and she's like, oh, it looks fine. Your latch seems fine. My nipples were so chapped and bloody let me stop you there. So when you say you were having issues with the latch, that could mean a lot of things, but let's break that down. Was the baby having a hard time getting onto your breast? Or she would get on and it would hurt? She would get on and it would hurt. Okay. Yeah. And I didn't know, like, it didn't really I had watched all the videos of how it was supposed to look, at where the baby would open their mouth really wide and go. And that's not really what was happening. But then, she was nursing around the clock as newborns do. And so I just said, okay, this must be just the initial pain that you feel with breastfeeding, which I know you're making that face. And I know now that that's not a thing, but
right.
I had heard that was normal to feel pain at first. So I just let it go. We were visited every day by a pediatrician from our practice. And a few of the days it was our actual pediatrician, which was great. But one of the days it was a different one from the practice. And I remember asking him, like, I've heard about this tongue tie thing. Does she have a tongue tie? Is that what's going on here? And, he was a bit old school, and he said, oh, tongue ties are just a fad. Oh, so that,
here's the headline for our podcast for this week. Tongue ties is just a fad. It's such a crazy thing. Like, how could a piece of anatomy be a fad? It doesn't even make any sense. That just means you haven't read the latest articles. That's what that
right.
So I want to go back a little bit, because you mentioned the hospital lactation consultants coming in and saying that the latch looks good. Right. So I just did a presentation this weekend. It was lovely, to speech language pathologists. And one of the points I made to them about lactation, because I was trying to teach them what we do as IBCLCs. And one of the points that I just kept driving home about it is, look at all an IBCLC who knows what she's doing, who's properly trained. Look at all the points that we assess. You can't do that by looking at a mom and baby nursing from the outside and say, latch looks good, see you later. Now, I don't blame those hospital LCs. I was a hospital LC. I know how hard it is. And I know that they don't have time to properly assess anyone. So I'm not dissing.
Yeah, she barely had time to be in the room. I'm not blaming her either. She was the only LC on that weekend. So just as a little funny anecdote, I had some complications during pregnancy. I was actually supposed to be induced. And I had my induction scheduled, and then I was in touch with the nurses all day for a couple of days, because they kept kind of bumping me a little bit. And they were just like, we are so full. We have so many people giving birth right now. It is crazy. We're just in this pickle. So, we're going to call you tonight at midnight, and that's when you're going to come in. And then my water broke around 8 p.m. So, I called them and I said, hey, is there a bed for me? And they said, yep. When your water breaks, there's always a bed when your water breaks. Yeah. So, but at any rate, the whole ward was super packed. There were so many. And then the other lactation consultant was off that weekend. So there was just one running around and trying to help everyone. Yeah. So totally understand. But so that was kind of the situation at the hospital. I did have an unplanned C-section. So we were there for almost a week, and I only had that one quick visit from the LC, like the day we were leaving, basically.
Yes. So then, let's just go back about that a little bit, because it's not her fault, but I want parents to know that if they don't think that things are going right, and the hospital LC comes in and says everything looks good, it doesn't mean they had a lactation consult. It doesn't mean that they shouldn't reach out for more help, because a lot of times they think, well, the lactation consultant said everything was okay, and she's the expert on breastfeeding. Mm-hmm. But that's not a lactation consult. That's a quick visit from the lactation consultant. So if you're a parent and you're either going to have a baby, or you're thinking back on your experience in the hospital, and things still aren't right, it's important to know that there is much more to an evaluation by a lactation consultant than what you experienced for the most part in the hospital. If you didn't get a good experience, there are lovely lactation consultants in some amazing hospitals that have the time and are doing wonderful assessments, but that's rare, right? It's rare. So
yeah, and I think in general too, having a baby during COVID, all the hospitals are so short-staffed, and everyone's just doing the best that they can. If I could change anything about this entire story that we're going to be talking through today, it would have been to reach out to an IBCLC immediately after. So I did reach that conclusion eventually, and we'll get there, but it not very early in the story. And that would be my only regret, or the only thing I would have changed.
So now you're in the hospital. Do you mind me asking, did you need to supplement? Because that's common when you're having such discomfort.
I did not. I don't know whether it just wasn't brought up to me or if I just am a stubborn person, but either way, I did not supplement when I was in the hospital.
That's amazing. Good for you.
I just it was just making the situation worse and worse. Right. So then after we left, I want to say we saw the pediatrician like 1 or 2 days later. Our pediatrician office, which I think this is somewhat common, has lactation consultants that are in office as well. And so my first several appointments, the lactation consultant would be in there with our actual pediatrician. So, I voiced my concern. I opened up my top and I said, this is what we're dealing with right now. Look at how bloody I am. Right. I don't want my baby eating my blood. And so she ended up giving me nipple shields, which I know that it's a bit of putting a Band-Aid on the situation, but I am so thankful for that Band-Aid, because without it, we would have had a different story too.
Yeah. Sometimes you need a Band-Aid. Sometimes you need a Band-Aid. And let me just stop and say like a quick something about nipple shields, because nipple shields either get a bad name or get passed out like candy, right? So the way I feel about nipple shields is that they're a good tool, but it really should be in conjunction with a lactation consultant so that you know what the end game is, and to make sure that the baby is actually nursing through the shield or getting milk through the shield instead of just nursing on the shield, which I've seen, right? So and also you want to make sure that it's fitting right, and a lactation consultant will be able to give you the right size if it's, because otherwise the milk isn't going to be stimulated. I had somebody who came to me like 2 weeks ago now, and she was very swollen. As you know, after you give birth, you puff up all over, including your breasts, and your areola is flattened. Your nipples look flattened because of all that edema, all that swelling. And it was like, a friend of mine gave me this term, and there's no other way to say it. It was like putting a shield on a balloon. There was no nipple coming into the shield, but she had the shield there, and this was given to her by a nurse immediately after birth because the baby couldn't latch. So now it looks like the baby is latching to her breast, but the baby's only latching to the shield, which was actually way too big. It was a disaster. She thought the baby was nursing and gaining weight. Good thing we saw each other early. But before she saw me, she got a tongue tie release. And like, what good would that have done? Because the baby can't even latch to your breast because your nipples are swollen. So we have to take care of the swelling first.
Yeah.
I'm digressing. But nipple shields, they're a good tool. I like them for babies who are used to bottle feeding and need to learn to come back to the breast, because that somehow that gives them something to hold on to. Like they're used to having something in their mouth that feels like that nipple of the bottle. So the shield kind of feels that way. So it's a good transition for babies who take a bottle who won't take the breast.
That makes sense.
Yeah. And for parents who are in such pain that now it's tolerable as long as there's still milk transferring.
Yeah, right? Absolutely.
And then there's some moms who I give shields to, and it doesn't make a difference in their comfort level. So it depends. It really does make it, it really does depend. It's very individual. Anyway, so thank you for bringing up nipple shields. So how did it go with the shield? Did it feel better for you?
So the shield, it did feel better. My nipples were able to heal, and I was able to continue nursing. So the shields definitely served their purpose. And also in one of those early in-office pediatrician appointments, I again asked about the tongue tie. And I'm not sure what made me ask again, because I'm the type of person typically that if a medical professional tells me an answer, I accept it, because they're the specialists. They went to school for this. I did not. So I kind of go with it. But for some reason, I brought it up again. And so then the pediatrician and the in-office lactation consultant, they both did a physical examination on Ophelia, and they both said, yeah, she definitely has a tongue tie. So they referred me to a local ENT.
Okay. So they said she definitely has a tongue tie, but you had to ask them.
Correct.
You had to ask them to examine her mouth. So what if there was something, I mean, tongue tie is major enough, but what if there was something else going on inside her palate, like her palate or something? And this is the first time they're really looking. It's kind of scary. Yeah. Anyway, and these could be very good pediatricians. I'm not saying that they're not good doctors, but we shouldn't assume that a doctor knows about breastfeeding, about oral anatomy, the way that those who study it specifically do know.
Right. And I do actually think that we're lucky with our pediatrician, because as the story goes on, like, she's been super supportive every step of the way. And we didn't, our pediatrician was not the one that said it was a fad. So that's good.
Right.
But so we went to this ENT. I think the appointment was made for about like a week or so later. And we get there, and it's not a pediatric ENT. I think parts of the country have that. It was just an ENT. So they see babies sometimes, usually adults. There were a lot of, elderly people in the waiting room as well. And we go in, and she examines the mouth, and she said, this is really just a slight tie, because a full tie would extend to the tip of the tongue. She doesn't have it extending that far. So, we really wouldn't do a release on a partial tie. So
what she's talking about, a full tie, is in medical language called an anterior tie, right? And what your baby had was probably, I'm guessing, a posterior or a little bit further back. So it wasn't recognized as an anterior tie, which is basically all we learn about in school. As doctors, as nurses, as midwives, we only learn about anterior ties. So ENT isn't expected to know this. Somehow we have to get the message from the pediatrician that they shouldn't be referring to an ENT who doesn't recognize infant problems. It doesn't make any sense. But they are trained to refer to other medical providers. And usually, although there are some great ENTs who do understand this, usually it's the pediatric dentist. And pediatricians are not in the habit of referring to a dentist, for consults. So there's that kind of like little bit of a glitch, and where things can sometimes go wrong. Now, did you have that? Did they say, she said that you were not going to do it, the ENT?
Yeah. So she's like, I don't do a release if it's just a partial tie. Okay. And so that was it. So, my husband and I left that day with Ophelia, and we just said, okay, that it's not that then. So I had the shields. I just kept nursing, and that was that for a bit. So in that early first month, we did have some issues with her gaining, which I know is like pretty common in those early days anyway. So we did start to supplement with just express milk. 1 2-ounce bottle a day, I think, was all we were doing in those early days. And so that was fine. We had some extra weigh-ins. She gained what she needed to. So by the time we hit the 2-month appointment, we had already steadily gotten on track. And so we did not have any appointments between 2 months and 4 months.
Wow. That's another common situation that can be very problematic. Right?
As it was here too.
Because, it's unfortunate that the schedule goes just according to vaccination scheduling, right? So they feel, and I'm not going to say pros or cons about vaccines, but we shouldn't just associate pediatric care is just vaccination, right? So that's the reason why you don't have an appointment there, because there's no vaccines to give.
Yeah.
But what about all the other things? Right?
Yeah.
It just boggles my mind the way
and especially with breastfeeding, like a lot changes between 2 and 4 months. And so to have no touch point during that time, and granted, I can call and ask the in-office LC questions or ask the pediatrician questions, but there was no hands-on the baby interaction for those 2 months.
Right. Now, do you know if that LC is an IBCLC?
I don't think so.
She's probably not. I mean, there are places where it is, and it's still good to have any type of lactation professional in the office, but everyone should ask. Those listening should always ask, because again, the same way we said about the hospital visit, if you're having a visit with any lactation professional and you're not getting the solutions that you think you need or deserve, ask if they're an IBCLC. And if they're not, then find one, because there's more help. There's lots more help than that person can give you, so there's a whole episode about IBCLCs if anybody wants to listen, but, so that's an important point. So now between months 2 and 4, what's going on for you at home? You think everything's going well?
Yeah, she's nursing all the time. Just the happiest baby, like anyone, which we didn't really have a lot of people around her because of COVID, and she wasn't up to date on all her shots yet and stuff. But anyone that met her, they were just like, oh my God, does this baby ever cry? Like, she is so happy, just like smiles all the time. And so, obviously lots of diaper output, and I'm home with her the whole time and just, loving life. I will tell you also during this time period, let me think. So, right around her 4-month well visit, it got bumped by a few days. I ended up, and this ties in, but I ended up having, a partially retained placenta.
Oh my goodness. Wow, you poor thing. No wonder you were having trouble with milk supply.
Yeah.
Right?
Well, so I didn't think I was having trouble then because there was there was so much, and I even had built a bit of freezer stash, but on top of the retained placenta, then during the DNC, I lost too much blood and they had to do a transfusion and keep me overnight. So my first overnight away from my baby was definitely very far from what I had ever envisioned, but I did have a ton of freezer milk at that time. Okay. So my husband was able to just keep her on breast milk that during my time away from her, I was able to pump in the hospital and all that. So, but so that happened in the same. Did
you say you had a C-section?
I did say I had a C-section. You had
partially retained placenta. That just makes me go, huh?
Yeah.
What was that? That's not typical. Just so you know that. That's not typical. We won't go down that rabbit hole.
I'm one of those Murphy's Law people, but one of the nodes or lobes or whatever on the placenta, I had an extra one is what they ended up determining. And during the C-section, when they were removing the placenta, it broke apart. And so I remember hearing them talk about how it had broken and they were getting the pieces out. So evidently a piece retained. Yeah.
So how did they determine that? Was it you were having symptoms? You were having symptoms.
Yeah. So I was bleeding a lot postpartum, but then they tell you you're going to bleed a lot postpartum. So that's tricky. And then around the time of my final follow-up afterwards, around 5 or so weeks, my bleeding had changed a bit. And so I said to my doctor, my bleeding's different. I'm still bleeding, but it's very clotty and it's just different. And so then they were like, okay, well, it could be that you are having your first postpartum period, but it could be an infection. It could be retained placenta. It could be this and this and this. So they tested for everything. At that appointment. And then this is, of course, the week of Christmas or something. And so I get a call between Christmas and New Year's, the results took a little bit longer to come back. Right. And they were like, so your blood test came back and you tested pregnant. So congratulations. And I was like, nope. And they were like, come in for an ultrasound.
Right.
So I went in for an ultrasound, and that's when they told
so
me
the reason that you would still test pregnant is because, and this explains the milk supply concerns with retained placenta. The placenta is the storage place and the manufacturer of progesterone. And the progesterone drops when the placenta is delivered, right? So if the placenta doesn't completely come out, the progesterone doesn't completely drop. And the progesterone dropping is the impetus for your milk to change to mature milk. So you were lucky that you were able to produce as much milk as you did with having that progesterone in there. So when they did the blood test and they see the progesterone and maybe some HCG still in there, right?
That's the HCG was what was coming up elevated. And so then they retested it while they were waiting for me to get in with the ultrasound. And then the numbers were dropping, but it was still high enough that it was alarming. And then the ultrasound, and the ultrasound was like the same week that there is the federal order of no like elective procedures. And they said, this isn't elective. There's a lot of tissue there. Like you need to have this surgery immediately. And so I did. And so that was actually, and I think I misspoke before, that was around her 2-month appointment that was resolved, not 4 months. That would have been a lot worse. But so that between the retained placenta and then the blood loss. So those were factors that we were dealing with again at that 2-month time period that brought us into that 2 months of not seeing the doctors at all.
Right.
So
plus your spirit at that point, you must be like wiped. I mean,
and
a lot of stuff to handle.
The recovery from the C-section was terrible. And then when I started to sort of feel like I had some energy and I could move around a little bit, having to go in for this. And then, having to be away from my baby was just really devastating for me at that point. So
that happened to you that way.
Yeah, thank you. So we go for the 4-month well visit and, we undress her and we place her down on the scale and I'm all excited to find out what the weight is. And she hasn't gained anything in 2 months. And I'm looking at them and I'm like, this is what? Like what? That can't be the right number. And so then they bring in like a different scale and they're doing all this stuff. And then they had measured her head circumference and then they like double measured that. And then they're double doing every measurement at that appointment. And I'm just sitting there freaking out, waiting for the pediatrician to walk in. And so she walks in and she's like, so I'm sure you realize that wasn't what we were hoping to see. And I was like, what is happening? And then meanwhile too, around, I want to say before 3 months, she just started sleeping through the night. Like she wasn't waking at all for anything.
And that's when you're supposed to celebrate, right? Yay, you did the right thing. Everybody's can't wait till the baby slept through the night and your baby's sleeping through the night. Yay. Right.
Yeah. And so I was asked, I remember asking, should I be pumping overnight? Like, do I need to do anything? And I received the answer that typically bodies will regulate and all the milk that the baby needs will be during the day. So you don't need to do anything extra. So
if the baby is gaining is the caveat there. If everything is going well and the baby is gaining should have been the caveat added there. Let's just do a quick wait for the baby to make sure the baby is gaining.
Yeah, that would have been good. But so instead, the pediatrician, she's super kind. She actually spends a lot of time in office with us. I always come with a long list of questions and I never feel rushed by her. So that's great. But so she was just like, so potentially the issue here is the sleeping through the night and that could have caused your supply to dip. Obviously, we had these other factors that could have impacted my supply as well, like the blood loss and the placenta, whatever. So she, and I didn't realize that the placenta had triggered the milk supply then. I had mentioned it casually to the LC when I was there. And she's like, whoa, it's amazing that there were gains at all. And she kind of explained everything that you just had. So I mentioned it to the pediatrician and all this stuff. And she was like, okay, yeah, so we have a lot of things that were working against us, but so here's the deal. I think it's because of her sleeping through the night. I think that impacted your supply. So, pump during the night, do this. She set up a whole plan, and she said, also, we need to do the supplemental bottles and And so at this point, I had a huge freezer stash, relatively speaking, I guess, but I would haka in the morning while nursing, and I would haka throughout the day, and just that adds up. I wasn't really sitting down to pump because pumping is definitely not my preferred activity as a mom. But just with the haka, I would freeze it right away, and I had a lot in there. And so I come home from that appointment and I'm feeling okay. Like I have so much milk in the freezer, it's fine. But then I realized by doing the math that we start giving her bottles that day, and I kind of figure out how many bottles we gave her that next day. I'm like, our appointment's 10 days from now. We're not going to survive. Even with me pumping, there's no way we can survive 10 days. We're going to use the entire freezer stash and need more. Mm-hmm. And since that was then the writing on the wall that we would need to supplement with formula also, we made the decision, my husband and I, that we wanted to start her on formula the next day, just as a 2-ounce bottle, because I was worried, or we were worried that, if she had issues with the formula, I didn't want one day for her to suddenly have like 10 ounces of formula out of the blue, which I'm sure a lot of babies just go like that and they're fine, but it was a concern. So we kind of were like, okay, we'll do 2 ounces one day, 4 ounces and so forth. And then we'll kind of have either one to dip from. So we ended up doing that. I remember just, sitting after she went to bed, I was like crying about it, because just for me, I like really didn't want to do formula. And I don't think there's anything wrong when moms do formula.
Thank God it's there.
Yeah.
But you know what?
I obviously needed it. It's made for people like me in this situation. My baby needed food and needed to gain weight. So
you
said, thank God it's there.
I'm going to go back to your pediatrician's recommendations, and I'm going to tell you what I would have recommended that day.
Okay.
First of all, she should have sent you to a lactation an IBCLC immediately. So if anybody's listening and they're in this situation where the baby, something's up with the feeding, you want to go to the feeding expert, right? Mm-hmm. Like it's almost like a no-brainer for me. Like something's not working with the feeding. What are we going to do to fix it? Giving bottles of your pumped milk or formula is not going to fix what's going on with breastfeeding, right?
Right.
Which now. Right. So what I would have said, first of all, every time you give a bottle, you need to pump, because otherwise you're going to lose supply.
So I was doing the bottles immediately after feeding. So every time I nurse, I would give a bottle.
If she needs, so in other words, you want to be making as much as she needs.
Yeah.
Right. So
yes.
Say she takes 2 ounces and then you give 2 ounces by bottle. She needed 4 ounces for that feeding.
Yes.
You're not telling your breast she needed 4 ounces.
Right.
So this is just education. I'm not criticizing what you did, because I think that people who are listening can gain from this. You always want to match what you're pumping. This is why I don't like freezer stashes, because you have to pump anyway. Once in a while, a security, whatever, it's good. But if you're giving milk all day long that's pumped without pumping, you're going to lose your supply. The other thing is, back to the haka. Now, again, I am, Elyssa, totally not criticizing what you did, because you did what you knew to be true and what was seeming to work for you. But I want people to learn from what I would have done for you, right? Okay. So it's possible that because she was having trouble transferring milk, that haka milk would have been better if you left it in your breast, because especially because your breasts were probably a little sluggish, right? With remaking milk, because your placenta was still there. You might have been taking milk that would have been easy for her to get at the next feeding. And now it's in your freezer, right? Yep. So like you totally did what seemed to be the right thing to do. But in hindsight, we can look at it and go, maybe that kind of kind of put it there too. And then the other thing is about the sleeping through the night. We want to look at how many feedings a baby is getting per day. And it should be 8 to 12, even if they're sleeping through the night. So if they're sleeping through the night at 3 months old, but they're getting 10 feedings during the day and they're gaining, that's fine, right? But it's not about the hours. It's about how many feedings, right? And that doesn't count if they're feeding all day long, which a baby that's not getting a lot at a time is probably not having any breaks in between the feedings. She was probably on you almost constantly.
And the feedings lasted forever. I was just, I'm hearing on-demand nursing, right? So I'm letting her nurse as long as she needs. And so frequently our nursing sessions would be an hour and a half long. Many of them were. And I had not heard anything about that being strange until recently. So, so that was kind of that situation. Wow. And I was actually, so after we started formula, and since that was kind of a sad milestone for me, that's when I was like, you know what, I am going to research lactation consultants at this point. And I didn't know the difference between IBCLC at that point and other lactation consultants, but I just looked for one in the area. I knew that lactation consultants have the option of coming to your house, which was very appealing to me. I ended up finding one in the area. She scheduled an appointment with me for I think maybe the next morning or something. It was great. She came for 2 hours. During the 2 hours, she weighed Ophelia before and after she fed. But then she also just did a thorough discussion with me on my entire medical history, Ophelia's medical history. She went through everything about my pregnancy, delivery, that sort of thing. She watched me nurse. She watched me pump. She watched Ophelia play. She looked in her mouth. She did everything that and more. But the funny thing was at first, so she weighed her and then I was nursing and we were chatting and, I could kind of see the gears turning. I could kind of see that she had already figured everything out and we weren't done with the appointment. And,
because we, as we were talking about before we came on, and it's one of the reasons why I want you talking about all that you went through, that we see the same story, a little bit different, a little bit individualized, but we see and hear the same stories that happen to parents over and over and over again, so that's why your story is so important to be heard, so that other parents realize that, hey, wait, that happened to me too, and don't feel alone or look to find solutions sooner than you were offered solutions. So
and I hope
she told you about the tongue tie. She's like, hey,
so she's like, I'm going to look in your daughter's mouth now, but I think I'm going to see oral ties. And so then she explained tongue, lip, and cheek ties to me. And I said, oh yeah, no. So we were told she had a tongue tie, but then we were told, it was just a slight one. So they don't do the release. And she's like, oh, there's actually not such a thing as a slight tie. And, so she did the evaluation and she said, there's a tongue tie here. Can you see it? Let me show it to you. Oh yeah, I can see that. And she said, and there's a lip tie here. So let me show that to you. And I said, okay. And then she said, and there's cheek ties here. So let me show like, oh, okay. So, and then she's like, oh, and her palate's really high and all this stuff. I'm like, okay. So she said that there is a pediatric dentist in the area that she works closely with, and she referred me to him. She also explained to me what body work was, and she referred me to a chiropractor and an OT. And at that point, she also was showing me just how my daughter was really tense in a lot of spots. And so she explained how that was all connected. And I hadn't really realized it. And of course, I had spent a lot of time doing floor play and trying to do tummy time. But whenever I was trying to do that, she would just kind of fuss and I would keep trying, but she wouldn't love it, basically. Right, and so The OT experience was really cool too, because she showed me different techniques to make it really. And I was telling you beforehand that the OT that I ended up working with, actually also her son had oral ties, and she had just gone through this. He's only a little bit older than my daughter. So it was fresh in her mind, and she was just like, yeah, my son struggled with tummy time too. Here are some fun things to do. So that was great. So we did that. We scheduled the release, and we hadn't seen the pediatric dentist yet. So the release was the same day as his intake evaluation. And they said when we got there, if we decided we didn't want to do the release that day, we could schedule it for another one. But I was just really determined that I felt like my supply was really low at this point, and I thought that the release would help bring it back, as well as just I wanted us to be moving in the right direction. One thing I didn't mention is when the IBCLC was here, and she did do the weigh before and after, despite me nursing for a long time. I want to say we maybe did like 15 minutes on each side, so not like not one of my hour and a half sessions, but so my daughter had gained 1.3 ounces total from both sides combined.
It's not the worst I've ever seen. It's not the worst. The other thing to add there for those who are, not familiar with how much a baby should be taking, if you want to think about the average intake is about 24 ounces in 24 hours. So if it's 8 feedings, it should be about 3 ounces, but every feeding is not the same. Right. And there'll be cluster feedings, and there'll be feedings where they get more, and there's feedings where they get less. So it's just a snapshot. It gives us an idea. But this was in the morning too. And so I believe it's supposed to be a bit higher in the morning. Yeah. Right? And the other aspect there is that if the baby stays on longer, they don't necessarily get much more. Most of what they get is early in the feeding, especially if they're struggling with mouth motions and extracting milk. So they're going to get it mostly. So staying on longer sometimes backfires, because now the baby's expending energy nursing and not getting too much more. And also, geez, you have no time to do anything. Your life, you're always nursing, which I'm all for attachment parenting, but there's a point where we have to,
well, even just
something else to do.
Doing floor time, doing other things. I felt like I barely had time for those things.
So for some people, it's better to be pumping for a couple of days. And that triple feeding adventure that everybody prescribes, I never let that go more than 3 days, because it's unsustainable, and breastfeeding is supposed to be an enjoyable experience.
Right. And that's definitely just takes its toll. And our pediatrician said the same thing of like, you do 15 stop, just because she didn't want Ophelia to be burning the extra calories of staying on. But
I would say extra sucks and swallows. Don't look at the clock. That's a lactation thing. Watch the baby, not the clock. I don't even have a clock in my office, so I don't know how long babies nurse in my office. We watch the baby, not the clock. You can kind of get a feeling of, it was probably around 20 minutes or so. But if a baby's actively eating, they're not going to be actively eating for 15, 20, 25 minutes, right? So you want to watch the sucks and swallows and then take them off and switch sides.
Are you a professional that feels like you didn't learn enough about tongue tie in school? Whether you're a lactation consultant, a nurse practitioner, a midwife, a doula, a doctor, a speech-language pathologist, a chiropractor, PT, OT, dentist, etc. I don't mean to leave anyone out. Anyone who works with pregnant or breastfeeding families in any capacity who is curious about tongue tie is welcome in the Professional's Guide to Tongue Tie in the Breastfeeding Infant. What you'll learn: we have 4 modules: assessment, treatment plan, frenotomy, and aftercare. So much great information, and it comes with a community. I didn't learn this in school, did you? Tongue tie treatment can be complex, and those who expect relief of symptoms with a quick snip or even a laser release, even by an experienced provider, are usually disappointed. Join me to learn protocols that offer an organized and simplified plan to support families through decision-making,
preparation, treatment plans, procedure if needed, and aftercare. Learn the teamwork model of care. Knowing why and which providers are necessary will make things easier for you and provide effective outcomes for your patients. Please sign up today. The link is in the show notes, but you can go to my website, tonguetieexperts.net, go to the professional tab. And one last thing, since you listen to my podcast, you'll get 15% off just by using the coupon code podcast15, and the word podcast is all in caps. Can't wait to see you in the group. Take care.
So I keep interrupting your story, but you have so many important and educational opportunities for me to interject with,
No, it's great. We're having a conversation. It's not one-sided. So we ended up going to the pediatric dentist, and he did the evaluation, which the evaluation, I just want to mention too, it's not just looking in the mouth there either. When I called to make the appointment, they did a symptom screening for both myself and my daughter. When we went in person, they had a whole checklist, and they were like, yeah, just indicate if either of you have had any of these symptoms. And I was just like, check. Right. My husband's looking over, and I was like, did I miss anything? And he's like, no, but you checked almost everything. You checked every box basically. Yeah. And a lot of the things I just didn't realize. And actually, one thing I want to mention, one of my weigh-ins that we did early on in that first month, we ended up seeing the Just a Fad doctor again because our pediatrician was off. And I asked him, and I said, this is really strange, but do you see the blisters on my daughter's mouth? Like, she just has these severe blisters. And he's like, yeah, I mean, that's just because, she's doing her work. She's doing her work at the breast. So and I was like, oh, okay. Now that I have completely submerged myself in this, oral tie culture, and I've read about every symptom, I'm like, yeah, no, at 4 weeks, that's not what that is telling us at all.
No, because the baby's not supposed to be holding on with their lips. She's holding on for dear life with her lips, trying to suck the milk out, My daughter, those who listen to me hear me talk about my grandson. I became a grandma in January, and I'm obsessed. But besides that, my daughter described it as, he's treating my nipple like a straw. Oh, and if you think about it, that's what gives the blisters, right? Because they're like literally coming on and sucking in. Like, you can't see my face in the audio, but literally coming on and sucking in and holding on that way. And,
it's a great way to visualize it. Yeah.
So now you have the procedure. You decide, obviously, it's the right thing.
Yeah. So in the office too, I know that you're not a huge fan of the levels or the grading or whatever, but he did tell us that the lip tie was a 4 out of 4 and that the tongue tie was a 3 out of 4. So it was kind of, validating to me in some way to hear that, it's not just in my head, or it's not just like this problem that I'm dreaming up, because it just had been a long road at this point. So she ended up having the release done when she was right around 5 months. It was that same week, I think. And the release was so fast. So if there's anyone listening and they're scared about baby being away from them, I know I was scared for that. She was gone and back in less than 5 minutes, and they do pre and post photos and the release. So, and it probably was like 2 minutes. It was definitely less than 5.
The procedure itself takes 30 seconds. If it's the right provider using the right tool, it's literally 30 seconds for the tongue and lip. So
and just taking them away and going down the hall and coming back, the whole thing was very fast.
So Elyssa, I also want to bring out something important that you were saying, that you felt validated. I think part of it that I see is that moms especially feel like they're doing something wrong. It's their fault. It's their problem. It's their nipples. It's their milk supply. It's their this. It's their that. And so many times it has nothing to do with what you are doing. It's the baby. Yeah. It's the baby's issue. And it's a getting together, it's dyad issue but it's not your fault. And that's the beauty that comes with that validation, I think, of there is something going on here. It's not my fault. I didn't do anything.
And she needed
wrong.
This release. Yeah. And honestly, before I contacted the IBCLC, when I just had that doctor's appointment, like, you need to do all these bottles, I was so upset because I was like, I've been starving my daughter for 2 months. Like,
oh no,
you know, because I'm her food source.
Right.
My husband's like, you can't hold yourself responsible. And I said to him, you know, it's easy for you not to hold yourself responsible. You're not her food source. She sees you and she lights up, and she has the best naps in your arms, but you're not feeding her. Like, I'm feeding her, and I failed. So it was extremely upsetting. And then
those are real feelings. Those are real big feelings that I think that we need to address as far as, you know, going forward. Like, you have to heal from that, because that's trauma. That's trauma. And, you know, you have a lot of healing to do from this experience.
Yeah, for sure.
I'm glad you're talking about it, because to me, that's the first step, you know, realizing that. And also the fact that you still had enough strength in you to know that just giving bottles is not going to solve this problem for me. This is
and I just was worried that it was going to keep dipping lower. And I also had heard people talk about triple feeding. I had heard people talk about power pumping and all these things, but they were kind of abstract terms. And I didn't want to start doing some regimen, but without talking to an expert about it first. And so when she was here, she gave all the personalized recommendations to me of what she thought I should do. And so those were the things that I started doing. And then also, so we had the release. I was able to nurse right away.
Did it feel differently right away?
I think there was just too many emotions going on right away. So, and you know, she was kind of fussy. She latched well. It seemed like a good latch. The big difference actually right away is that I tried it without the shield. So my IBCLC said I can start without, and if seems like she's not doing it, then I have it with me just in case. So I did it without. And so that was her first.
She latched without the shield right after the procedure. That's amazing. That's real. She's a strong little lady, your daughter.
Yeah. And so then for about the next week or so after, some of our nursing was without, some was with. I would try every session without first. And then if she seemed just like fussy or irritated, I would just pop the shield on and finish the session. The IBCLC came back. So the release was on a Wednesday, and she was back here on Monday after. So it gave us a few days to kind of settle in. By the time she came back too, we weren't on Tylenol anymore. So it was kind of like a good time. So she came back and she did the pre and post weighing again. And this time Ophelia took 3.6 ounces.
Wow.
So that was just so crazy to me.
Were you crying? I mean, I'm about to tear up. Like chills. I got all kinds of chills. That's amazing.
And she's like, you did it, Mama. Like you don't need to supplement. Like that is plenty of milk in a feeding. You're good. Like you're good to go. It's done. And so I just couldn't believe it. At that point, we actually still have extra appointments for weigh-in. So I had a weigh-in, I want to say 2 days after her appointment. And so I checked it over with the pediatrician, and I was like, I'm a little nervous to stop doing any of the supplemental bottles because we're still trying to get back to that curve. We weren't there yet. And she was like, I mean, I do agree with you that if you, but she's like, at this point, I think since we know that your baby is getting the milk from your breast and we know that your supply is at a healthy point, then really what it comes down to is like reading those hunger cues. So if you do a feeding and she seems like she wants a little bit more, that's when you could do something, but it doesn't have to be an every time. You don't have to say in a day, I'm going to supplement X ounces, like just kind of go off of your baby at this point. So some days I don't do any additional. Some days she seems hungrier and I do some amount. A lot of times it ends up just being breast milk that she's getting. Sometimes she's still getting formula. I have definitely gotten over being upset about formula. Now I'm just at the point that I'm grateful that it exists. So that was good for my mental health to start being grateful. But we do have her 6-month appointment coming up this week. So that's going to be the big test for me, because her pediatrician suspects that she would be back on her growth curve by that appointment. But
the important thing to know is that, like, figure out the date that she got weighed last and this date, and she should gain an ounce a day about to catch up, and she may not, even if she's not on her curve, if she's gaining an ounce a day, that means that she's getting what she needs. The curve is like arbitrary, right? Like, at this point, because she's going up yes. appropriately. So it's about an ounce a day. So if it was a month ago, she should have gained 30 ounces, but you must be seeing her fill out now. You must be seeing like her clothes are tighter and.
Yeah. So, she had to bump up, her pajama size. She's in the 9 month now, a few weeks ago. Luckily, I did mention the measurements earlier, length and head circumference. Those actually were fine the whole time. I know sometimes when babies have the weight issues, that becomes an issue too. We didn't have that particular issue. But yeah, like she has this little belly now, and it's great. And I thought maybe I should have known that she should have had the belly before, but no. I don't know. But so she has been gaining really well. And even at first, the weigh-in appointments were every week. And then I think it went like a week and a half and then 2 weeks or so. And then, so now we're at the 2-week point. Even if she is fully on the curve and everything's good, I'm not going to let it go another 2 months. It's too stressful for me personally, especially after the ordeal we've gone through. So I'm going to just want those weigh-ins just to make sure we stay on track. I think, so I do love breastfeeding now, especially now that it's going well. And I do think it's just like a great bonding experience for us. But I will say for me, the hardest part is the not knowing what your baby's actually getting. And I'm just a very analytical person. So to not be able to really play the numbers game is hard. But so I think just like some of those extra touch points for me will help.
Yeah, absolutely. And also I would think if I were your pediatrician, I would want to see the continued growth, right?
And I'm sure she probably would suggest it anyway, but even if she's like, oh, you're good. No, I'm not good.
Right. So I just want to add something about the continued supplementation, right? So something to keep in mind is, this is not advice to you, but this is advice in general, because I don't know, I'm not seeing your feeding, right? But in general, if you're giving a bottle after a feeding, they're going to last longer and not take as much from the breast the next time, right? So there's a point where your faith has to be like, okay, because how else do we know that they're getting enough? By their diapers, both pees and poops, right? So, and how they're resting in between. And there are ways to make it more palatable for a type A person to be secure in the numbers early on. Right. So you should have, if you were working with a lactation consultant, you would have been given more parameters it's not just like, oh yeah, just nurse when she wants. No, it's a lot more than that, right? And so the other thing about mixing in formula, if you don't have to, if you ever have breast milk, give the breast milk, don't save it, because even the American Academy of Pediatrics suggests the first option is mother's own milk. And if mother's own milk isn't available, the next recommendation is donor milk. And after that, it's formula. So if you have breast milk, give the breast milk. And I'm not preaching to you, I'm just saying in general. Just knowing that, you're at a point where she's starting to thrive and starting to build some trust in your own self again, because you got knocked down a couple of times there.
Yep.
And that's big. You need to be built back up. And I don't blame you for wanting to know exactly what's going on. in a feeding. But I wish I could turn back the clock for you and get us to lactation care and good lactation care earlier, and that you didn't have to go through what you went through. We were chatting a little bit before we came on, and I don't think, some of the situations where we're sending the baby for release right away, I don't think that's the opposite extreme of what you had, right? So I think that there's a middle ground. I don't think a newborn should have a tongue tie release. And there are going to be professionals listening to me saying, what? But no, I think that we have to give that baby a chance to acclimate to the world, see what's going to be with mom's milk supply, heal what's going on from mom, including trauma and healing from the actual birth, support them on the way, and then see if it's actually the frenum that's causing the problem in the breastfeeding relationship. So that goes against some providers who don't understand that newborn period as much as I do, because I'm also a midwife and I've been there for a lot of newborn nursing relationships. And I know that there's a lot of times when there's other factors that are affecting what's going on. And we can see a frenum, but it's not just about the frenum. It's how it's functioning, right? So I just had to do that little preach there to get the message out. But Elyssa, it's been wonderful hearing your story, because I know how many people are going to learn from your story. It's been a little bit heartbreaking for me to hear, because I don't think anyone should have to suffer this way, have to be literally mistreated the way you were on a couple of levels, or missed or gaslighted or whatever was going on in a couple of your healthcare encounters there. But I'm glad that you and Ophelia are on a good track right now, and that you had the mommy instinct to know, to keep going, to keep valuing that goal that you had and what you wanted for you and your baby. I mean, that in itself, I applaud you. I would be giving out gold stars if I could. All the mamas that get through this without any support and no prior medical experience, so you're not a medical professional. Nope. You figured this out on your own and you went for it. So I congratulate you on that.
Thanks. And I hope that the story is helpful for someone else. I think I might have said it to you before we were recording. I don't remember. But the biggest thing, I think, if I could change anything, would just be to have talked to an IBCLC immediately, even if I thought everything was great, which I obviously didn't. But that's the one piece of advice I feel like I'm going to give all of my friends moving forward. Just right away, make sure you have that person on your speed dial. Make sure you have that relationship formed. In office too, and
wait, you're fading a little bit. The connection went wonky.
Sorry. My internet's. Can you hear me?
I can hear you now. Yeah.
Okay. Sorry. It just popped up saying my internet was unstable. But yeah, so just my piece of advice for my friends moving forward, and for strangers, would just be to have the IBLC relationship started at the beginning, even if nothing's wrong, because that will just really set you up for success. Have that person to answer your questions. And I can just text her. I texted her today, hey, I have clogged ducts today. What should I do? And she wrote back right away with what she wanted me to do.
Shout it from the rooftops. Get that message out. So Elyssa, thank you. I know you have a very busy schedule. You have your daughter, you're back to work, and I really and truly appreciate you taking the time to chat with me today. It was wonderful. Thank you again for being here.
It was so nice to chat with you. Thanks so much for your time too.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.